Robin Morrison with Linda Miles here in the Patient Prism video studio today. Linda and I are co-founders of Oral Cancer Cause, and we'd like to speak with you about the HPV vaccine and the importance of speaking about it with your patients. Linda, can you share a little bit about what you and I talk about and our concerns about HPV vaccine and not enough of the young people having that and being educated on it?
Yes, it's such an important part of educating the patients while they're in the dental practice, whether it be the hygienist or the dentist, of the importance of talking to their healthcare professional, because parents are totally unaware, many of them, about the high rate of head and neck cancer. And there's been a huge increase in the past 10 years, especially young males 20 to 40, and a lot of those percentages are HPV related. So it's such an important part of taking care of their children, and there's a lot of reasons why parents are not having the vaccine. Could be that it's a 3-series vaccination, and it's, if they have 3 children, it could be upwards of $1,000 for all 3. Other parents have expressed a concern that the vaccine could be dangerous, and they don't feel it's been on the market long enough to know what it could or couldn't do other than protect. And it's like one of the experts that I talked to about HPV vaccine. In Europe, it's part of the school immunization. The government pays for it, and it's given as part of the school immunization. And in our country, it's up to the parents and the healthcare professionals to educate the parents enough to make the decision. Some parents are fearful that it will cause their children to ruin their reproductive organs. And as the expert told me, 4% of the population will have an adverse reaction to any vaccine on the market, whether it's shingles or the flu shot, they'll have an adverse reaction. And that isn't a high enough number to let 96% of the young kids go unprotected, because it's a deadly, awful disease, as we both know. And there's a lot of parents that say, well, I don't want to have my children vaccinated. It might give them permission to be promiscuous. That's some of the rejection we've heard. And so I think it's really up to the dental practices, the medical doctors, the pediatricians, to educate the parents about the importance. And I hope more and more patients and more parents will take a look at this and protect their children.
Right. And I'm finding now, I'm hearing the pediatricians are recommending it.
Good.
Now we have to do a better job of getting our dental professionals, number 1, educated on it, and number 2, feeling comfortable speaking about this with the parents and the patients.
Right, bringing it up by, saying, one hygienist told me that she says to the patient, do you have a boyfriend or a girlfriend? And that's her entry into talking about it. Then another hygienist said that the parent was upset. And so I think somewhere on the health history there should be, a release of explaining, we will be able to discuss it with your child, but some parents prefer that they do it themselves.
Right,
So a pamphlet would be good in a dental office about the importance and the reason, the benefit to the child.
Absolutely. And we'll get some information up on our website so that parents can use our website and practices can use our website as a reference to get more information so they're educated and comfortable on it.
I think it's a great idea, and I think that we could probably have some dentists actually help us with some sample entry conversations about this important but sometimes sensitive conversation.
Absolutely.
Yes.
That's great.